Hello, this is Dr. Bob Evans, and welcome to our podcast, Parental Alienation from Couch to Courtroom and Beyond. We will discuss the resisting and refusing dynamic, commonly referred to as parental alienation, how you'll know it's happening in your case, and what can be done about it. Parental alienation can cause stress and trauma in high-conflict cases. These podcasts focus on how attorneys and mental health professionals can support families and children. This is, I think, episode 32. If I may be off one or two, I don't know. I didn't double-check before we started today. But today we have a special guest, Dr. Michael Bone. And Dr. Bone and I are going to talk about the different roles that you find in these litigation cases and the significance of the roles in terms of the dynamics of parental alienation. Why in particular these are really important. And so that's what we're going to do over the next couple of podcasts with Dr. Bone. But Dr. Bone, Michael, why don't you introduce yourself and tell folks, what you do and how they get in touch with you if they want.
All right. Sure. Well, it's my pleasure, Bob. As you know, we've been doing these kinds of things together for many, many years. And it's always a great pleasure. What I do, I have an office in Winter Park, Florida, but I am involved in cases all over the country in a consultative basis. Basically, what I have come to realize is the family law system is not one that will hold your hand and walk you through these kinds of things. So there needs to be some help in this because of the unique characteristics of parental alienation. I mean, one of the things we see all the time, and this is, I think, so important, is that all these cases are based on a phenomenon where the alienating parent is trashing the other parent. That's a necessary ingredient to create this. So with that in mind, when we talk about the roles, we're going to be looking at, are the roles aware of the possibility of what they're being told is not true or distorted or exaggerated? And so it depends. That's the lens I think we need to look through when we look at these different roles, is how equipped they are to manage that.
So we're going to let's start, Mike, with one of them. And this is a very common one. And that's where somebody is involved with a mental health professional, a therapist, a counselor, however the child is involved with them. Maybe perhaps even the favorite parent is involved with the therapist. And so typically this is a very common scenario. And we could talk about some of the interesting dynamics of how some favorite parents will do what we refer to as therapist shopping.
Yes.
We'll come back to that notion too as we talk about these folks. And so it's kind of an interesting position for a mental health professional. Most mental health professionals, in my opinion, I think, and it's probably true, get involved in this business because they want to help people.
Yes.
And somehow they get roped into these cases that can be pretty awful, and they may wind up doing things that at some level might be borderline unprofessional.
Yeah, exactly. And a lot of the errors made by the therapists are really, I think that's a good way to put it. They can get themselves in trouble without realizing, because they think they're fighting the good fight. They think they're typically, a lot of the counselors that are put in this position believe they are protecting a child from being abused by the targeted parent, because they don't realize that, in fact, the dynamic is that of alienation. So they become actually, ironically, part of the problem.
They become advocates. They advocate for, at one level, the child, but they advocate frequently for the favored parent.
Yes.
So it's almost kind of a blurring of a role there, because if somebody comes and brings their child to the therapist, and typically it's not going to be a very obvious reason that they come there. They're going to say, oh, the child is dealing with a divorce and not doing well. The child's depressed because they're getting a separation or a divorce, or they're victims of abuse.
Yeah.
I need you to talk to, and the therapist then takes that, applies a clinical model versus a forensic model, and proceeds very clinically, accepting whatever they're told and proceeding in that direction.
I mean, there's the rub right there. I mean, in sort of mental health counseling 101, the first thing you're taught is to accept the patient or the client, whichever you call them, in their truth, their world. And so we just have to accept what we're being told, that which makes sense. But the unusual thing, or the predictably unusual thing about parental alienation cases is the counselor may not be aware that probably is not aware of all these adverse influences on the child, and may not be aware of suggestibility issues. I mean, a lot of therapists really don't know much about the research based in what we know now about suggestibility, which is very significant about how easy it is to influence a child. But if a therapist doesn't know that, they're very likely to get sort of sucked into that silo and begin to support the alienating parent.
I think there's a prevailing attitude among a lot of people, and we'll talk about the different roles, the judges, the attorneys, the custody evaluator, the guardian ad litem, you name the person, the parent, everybody thinks they know when a child isn't telling the truth. And if somebody's listening to this, I'm going to bet money that people are going to say, "Oh, I know my kid. My kids, they'll definitely do that. I can tell when my child's telling the truth." And I'll never forget. I'm going to go a little bit of a side. Years ago, I remember my dad had a recording, a video of a psychologist who was being interviewed, and the psychologist swore, basically on a stack of Bibles, that this woman, this psychologist, knew when her child was going to tell the truth and tell a lie. And so it was like one of these 2020 kind of shows back in the 70s and 80s. And so apparently they hid a toy gun somewhere in a playroom and told the kid, don't touch the gun, right? Just don't touch, go play with anything you want to, but don't touch the gun. And the psychologist said, if you tell my kid not to touch, I swear to you, he's not going to touch that gun. Everybody leaves the room, and I tell you, you know what, the sun's coming up tomorrow, right? The kid goes right to the gun, starts playing with it. The mother comes in later and says to the child, "How'd you do? I'm sorry, it's gone. How'd you have a good time and all that?" And say, "Oh, by the way, was there anything unusual? Did you touch that gun at all? Because you said not to touch it." "Oh no, I never touched the gun." And the psychologist's mother was absolutely totally blown away that he thought for sure that this kid would never he would tell the truth, and she'd be able to tell whether or not the kid was telling the truth or not. So the bottom line is, and we know the research out of Toronto with Kang Lee, that no one knows absolutely whether or not a child's telling the truth. No one, no police officer, no judge, no lawyer, no teacher, no parent of another child. No one knows. It's all chance. It's 50%. Interestingly, look at the research that Kang Lee did. The only group that came closer was the Secret Service. And everybody was like 50% or below in terms of telling 50 chance of telling if the kid's telling the truth. The Secret Service are at a 65% chance.
But the Secret Service is always looking for deception.
That's their job.
Exactly.
Anyhow, that's a little bit of an aside. The point is, the therapist takes that person. Well, and you're a therapist. You're sitting here, you're listening to us. Well, what am I supposed to do? Mom brings the kid in. Dad brings the kid in, says the kid's been abused by the other parent. What am I supposed to do?
Was that a question?
Yes.
Well, the first thing is, and what's interesting, all these things are governed state by state. I mean, licensure laws, administrative code, that's all different state by state. And there's no absolute standard that basically says when a therapist is seeing a child whose parents are divorced, no longer together, there's no absolute standard that says, well, you need to meet with both parents first before you meet the child. I'm not aware of that being which is shocking, because that is the standard of care. Before treating a child whose parents are divorcing or divorced or no longer together, they really need to have both parents and hear them separately, typically, before ever seeing the child. And that's where you're going to pick up your first clues. Because when a child says they don't want to see a parent, that is very unusual. And if a therapist doesn't know that's very unusual, they're likely to take it uncritically and just sort of accept, well, that's reasonable. This parent must have done something. And that's just not, the research shows us consistently that is not how it works.
Well, and typically the scenario would go along the lines of, well, the child's been abused. You talk to the child will agree that he's been abused or she's been abused or whatever. You're going to, clue number one is going to be, there's not going to be a lot of details. If they're not telling the truth, if they're making it up or they've been told to say something, okay, they won't have a lot of details. They'll probably not be able to tell you when and where this happened. Depending on their age, sometimes you need to actually be a little suspicious. If they're like 2 and 3 years old and they're telling you that they've been abused, I think you need to kind of step back and say, I need to look into this a little bit further.
Yes.
Okay. So you can even get an older child, but they should be able to give you some details about things. Then it's like not just what the universal procedure is, well, how did you feel? The second thing would be, okay, what did that parent do? How could we make that better? Or what if we had a conversation with that parent? We brought that parent in. Would you be okay with that? Oh no, I never want to see that parent again for the rest of my life. I wish they were dead. That's pretty unusual.
That's a big red flag, consistent with parental alienation, really.
Right, exactly. And then we go through the whole list of parental symptoms. For example, is the child using the same vocabulary that the parent who brought them in? Are
Right.
they, is there anything, any variation on that theme coming from the child or the other parent? Um, I think it's probably if you're treating a child, no matter what the case is, no matter what the reason is, I think it's always, I think you said, it's a good standard of practice to talk to both parents,
Absolutely.
no matter what it is. Child doesn't feel good. The child doesn't want to go to school. The child's wanting to bed. Whatever it is, you want to talk to both parents.
Yes. Yes. And that's one of the things that is again a big red flag. One of the things that we didn't mention earlier is sometimes an alienating parent will go, as you said, sort of therapist shopping. And they may, if they come across a therapist that insists on seeing both parents, chances they're going to go find another therapist, and that's as far as it's going to go. That's a red
Exactly.
flag. So that's
Exactly.
one of the best ways to protect for a therapist to protect themselves is to insist. Standard. It may not be in the statute, but it is a practice standard that should be respected.
It's kind of reasonable and sort of common sense.
Yeah.
The other piece, obviously, I hope people are saying, like, has there been a change in the family situation? What's going on in the family? You're talking about that with the parent. You're going to find out, are they separated? Are they divorced?
Right.
Are they in the middle of litigation? Is there an expectation of the parent that that therapist is going to testify? I think that's another flag.
Yes.
If you're
Absolutely.
bringing,
Because in most states, and then again, vary state by state, but therapists who are treating a patient don't have all the information they need to be able to write a letter to the court making a recommendation. But they don't realize that very often and will get pulled into doing that and they kind of get themselves in trouble. But what's still surprising to me, I find that most judges don't realize that. They tend to think of a therapist, well, they've been working with this kid for a long time. They must know what they're. So judges, there are a lot of mistakes made.
well, yeah, and I think the other point is too, is what frequently a therapist might tell a parent is, look, I'm not going to testify. There are a lot of therapists that want nothing to do with court.
Absolutely.
And what they might do or might be asked to do after they declare that they're no longer going to testify is, well, would you write a letter? Tell the court what's happening to my child. Tell what's happening with the child and what the child might need. Okay, maybe and shockingly, therapists frequently write letters telling courts the child shouldn't see the other parent for a
Yeah.
period of time. They're really traumatized by the events. They have no idea if the events occurred
Right.
because they were just told that.
Right.
Okay. And that's,
In therapy 101, you accept what you're told if you don't know better.
and what you find frequently is that the allegations, particularly about abuse, typically come from one source, the parent. Well, the child told me. The parent didn't witness it. The child told me the last time I was over at the other parent's house, I was touched. I was this, I was hit, I was beaten, I was whatever. And so the parent will come back and tell the therapist what the child allegedly told them without any, and then frequently, depending on the age of the child, We see this in investigations. The child doesn't say anything,
Yeah,
doesn't report anything. The therapist will say, "Well, how are things going this week?" Or, "When the last time you saw your other parent, how did that go?" And the child might say, "Oh, okay, fine, whatever."
yeah,
Never. I have one case was really interesting. It actually told the child investigator uh, after disclosing, "Oh, I've been abused," and the other parent did X, Y, and Z. And the investigator said, "Well, can you tell me more about that?" And I am telling you, I'm not going to, I think I might be quoting it. That's all I could remember.
yeah,
And that's, the other child actually said, that's all the parent told her.
right. I'm glad you said that, because one of the things that happens with alienating parents, because a lot of alienating parents, and this is another topic, but there's a high incidence of certain personality disorder, and
Mhm.
a parent who is believes that the child, the other parent is dangerous in some way. And they may really believe that, even though it's not true. They will start interacting with the child to not realizing the way they interact with the child and the questions they ask influences the answer. So they'll ask a leading question about, are you safe? Can you? Do we need a safety word when you're over there? Which sends a very powerful message. And the child may respond to that and agree. But then that parent now gets corroboration for what they might have suspected. So there's this whole narrative that begins to evolve between the parent and the child, the parent not realizing how how they're influencing the child's answer.
Well, and Stephen Cece's work tells us too that when you start doing that kind of inquiry with the child and that kind of dialogue with that child, that becomes a reality for the child.
Yes.
And multiple questions, multiple interrogations, multiple suggestions to the child that they've been harmed in some way by the other parent, that becomes a life of its own in the child's mind.
Yeah.
And people find that very hard to understand because there's a prevailing thought of, well, if a child says it, it must be true.
Yeah.
And that's not at all the case.
Yes. Exactly. I mean, that perception. Children don't lie, even though it's been shown to be grossly untrue for decades and decades. It's still there.
Oh, yeah.
It still sort of hovers around, and it inhabits these cases sometimes.
Very much
Judges
so.
don't really understand that.
Yeah. So that's pretty much our conversation about therapists. I think there there certainly need to take a look at some of the flags or warning signs when somebody's coming into their office and trying to get them to recruit them in a
Yeah, that's a
fashion.
great way to put it.
Yeah. But and are there cases where children really do need counseling and therapy because of a divorce and separation? Of course they do. Okay, but just be guarded as a therapist. Be guarded um, in terms of you don't want to be used.
Yeah, well, that's a great way to put it. I think the biggest red flag is the insistence or the failure of insistence to see both parents before seeing the child. That's huge, and
And I
that's very
think
common.
and I think there needs to be a little bit of an inquiring mind in terms of somebody telling you about something that occurred in a child's life, not necessarily an investigation, but certainly some kind of an inquiry of,
Yeah,
is this real? And the
yeah,
other thing is, if somebody talks about another parent, my argument always is, how do you know that other parent exists if you don't contact them?
exactly. Exactly. Yeah. These are just really, to me, as we take a few steps, they really are common sense things that get sort of lost very often when a therapist is approached by a distraught parent bringing a 10-year-old kid, claims to be this and that, and afraid of the other parent. That the therapist just responds to that. That's a problem.
Exactly, exactly.
Well, that's I think we've covered most of the issues on dealing with counselors. I'm sure there's more involved. I'm sure we'll touch on those as we
To go
go forward.
along.
But I think one of the things most important to remember is that these cases of alienation are unique in that they really have a predictable component of misrepresentation of the other parent in a negative way, and that's you see that over and over. And if the therapist doesn't understand that, they're going to get this likelihood they're going to get pulled into their into
And it appears to be occurring with such frequency now.
a,
There seems to be somewhat of a spike in the cases. I think the phenomenon of alienation is getting recognized. Professional associations are talking about it now more than they would previously, kind of denying it existed or kind of shied away from it. They're now looking at, hey, this is an issue that we need to really take a look at in across the board. The APA, the NCNJ, there's a bunch of organizations now are dealing with it and saying, yeah, we got to take a look at this thing. Mike, when you first came on, I don't think you told people how to get in touch with you. And so I'd like you to give them your email address or your website.
Sure. Let's start with the website. It's www.myname, jmichaelbone, all one word, jmichaelbone.com. And my email address is michael@jmichaelbone.com. So if someone just shoot me an email and I will respond back.
Mike, thank you very much. And
pleasure as always, Bob.
We'll see you next time.
Absolutely. Take care.
Thank you so much for joining us today. For more information on this topic, please visit www.drbobevans.com or www.naopas.com. We offer classes for both legal and mental health professionals to help educate them on the signs and strategies of parental alienation and how to move forward for a healthier environment for the children of divorce. Please visit www.naopas.com and sign up for our courses and use coupon code PODCAST for a 50% discount.